Blood clot in your leg. This is also known as a deep vein thrombosis. What is it? Why do we care? And what can we do about it? Let's get into it. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor, and I will tell you that as part of my job as a hospitalist, I do encounter deep vein thrombosis from time to time. So exactly what is it? Well, as the name implies, deep vein thrombosis, it's a blood clot or a thrombus that's located in one of the veins, but more specifically, a deep vein. So a vein that's very deep within the body, such as the femoral vein. These aren't the little superficial veins that you can see. These occur most commonly in the legs, but you can also get them in the arms, in the abdomen, even around the brain as well. But most commonly we see it in the legs. And what happens is you get a blood clot that blocks flow of blood flow through the vein. This can then cause the leg to become swollen, red, painful, which leads to a bit of a diagnostic conundrum for the doctor because lots of things can cause your legs to become swollen. Kidney problems, liver problems, congestive heart failure can cause swelling in the legs, but more commonly these organ dysfunction leading to swelling, it's usually in both legs. It's not typically going to single out one leg over the other. So if just one leg is swollen, that's more of a clue that this could be a deep vein thrombosis. Now the leg also tends to become red and irritated. You can also see that in infections such as cellulitis, but the characteristic of the redness is different. In cellulitis, it's usually more well circumscribed. The redness might be a brighter color, and you might have other signs of infection like fever or an elevated white blood cell count. But it's tricky because you can also get those with a blood clot as well. So before we move on, let's talk about why you might get a blood clot in the first place. I mean, it's not something that happens all the time. There are things that increase risk for blood clot formation. These would be what we call hypercoagulable states, such as antiphospholipid syndrome. These are chronic diseases that can make you more likely to form a blood clot. Other stresses on the body can also increase risk of clot formation. These include recent surgery, pregnancy, or infection. We did see more blood clots with COVID-19, for example. But in addition to a predisposing condition, many people who form deep vein thrombosis also have a certain degree of immobility. Maybe they're bedbound, or because of recent surgery, they just can't walk or move around normally. This causes the blood to pool and makes it more likely to form blood clots. Okay, so let's say you got one leg that's swollen, you go in to see your doctor. What is he or she likely to do? Well, first of all, it's going to be the interview. You'll get asked questions like, have you had any recent prolonged immobilizations, such as long plane flights, any recent surgeries or procedures? But then it's going to move on to the physical exam, where the doctor will look at the leg very carefully, looking for any of the features that we discussed earlier. Redness, swelling, tenderness, especially if it's on only one leg, not both legs. Then the doctor may order a blood test. So there's a test called D-dimer. This looks for breakdown products of blood clots, and it's quite convenient. It just takes a small sample of blood to be sent to the lab, but the problem is that it's not very specific. A lot of things can cause this test to appear abnormal, not just blood clots. In fact, any sort of inflammatory state is, okay, we got a visitor here, but all right. Any sort of inflammatory state is likely to make the D-dimer appear abnormal. This could be an infection, a trauma, injury, or even things like cancer. And actually, that reminds me, another really big risk factor for these is active cancer. Okay, this is getting a little distracting here, but active cancer really does increase risk for forming blood clots. In fact, a lot of the times when I see these deep vein thrombosis in the hospital, it's in people who also have cancer. So with that in mind, the fact that the D-dimer is not particularly specific for blood clots or deep venous thrombosis, is it even useful at all? Well, it can be. So people who are otherwise healthy and have no reason to have an elevated D-dimer, you might get this as a screening test, because if it's negative, it's highly unlikely that there's a significant deep vein thrombosis. In this regard, we say that this test is sensitive because you can help to rule out the disease, but it's not very specific because lots of things can make it appear positive. And I'll be honest with you, in the hospital setting, I don't oftentimes order a D-dimer because most of the patients that I'm seeing are really sick. I mean, if they weren't sick, they wouldn't be in the hospital. And so they have lots of reasons to have this elevated test. If it comes back positive, it doesn't really tell me much. So oftentimes I do skip this and I go straight to the confirmatory test, which is an ultrasound. So with an ultrasound, what happens is there's a probe that sends sound waves into the legs. I don't really understand a whole lot about the physics about this, but it allows you to visualize the veins inside the leg. And the first thing you look for is compressibility. So Veins are very floppy. They're very loose. You apply pressure and then you can squeeze the vein down and compress it so it looks almost flat. Contrast that with arteries, which have very thick muscular walls. They're much more difficult to compress. So a vein should be compressible. But if it isn't, if you visualize the vein, you apply pressure and it doesn't really compress all the way, or it's very difficult to get it to compress, then that means that there could be something solid inside the vein, and that solid thing being a blood clot. The other thing that the ultrasound does is it looks for blood movement within the vein. So you expect to see normal movement. If you don't see normal blood flow, then it makes it all the more likely that there is a blood clot there. Okay, back to the story. So let's say you've got a leg that's swollen and red. You go to the doctor, that doctor orders an ultrasound, and sure enough, it shows a blood clot. What's the big deal? I mean, our blood forms clots. That's why we don't die every time we get a small cut in our skin. We don't bleed to death. Well, the problem with this blood clot is not only does it cause the swelling and pain in the leg or wherever else you have the clot, in the arms, for example, but the clot can migrate. So it can move from veins in your leg all the way up into the heart. And then from there, it can get lodged into veins in the lungs. And we call this a pulmonary embolism. Now this, especially if it's a large clot, we call this a saddle embolus. This can even obstruct blood flow from the heart into the lungs, putting a lot of strain on the right side of the heart. That can even lead to cardiac arrest. So the pulmonary embolism is, there's no question about it, a potentially life-threatening complication of a deep vein thrombosis. So with that in mind, with this diagnosis, you can't just let it slide. You got to treat it, and the treatment is typically with a blood thinner. So this is anticoagulation. In the old days, back when I was in medical school, there weren't really a lot of options. We would just, man, I feel so old when I say that, but the anticoagulation we would use would be heparin if you were in the hospital, but then going home, it was typically warfarin. The trouble with warfarin is that while it's convenient, it's just a pill that you take, it requires frequent monitoring, so that's not so convenient. People on warfarin have to go in and get their blood drawn to check levels. It's called the INR, to make sure that the level of anticoagulation is within a therapeutic range. But thankfully now, over the past 10, 15 years or so, we've developed new blood thinners that don't require this level of monitoring. Dabigatran is an example of this. So if a deep vein thrombosis is identified, the treatment will be with a blood thinner. Usually you would have to take it for at least 3 months, maybe even longer. So specifically, how do we decide duration? How long to take this blood thinner? Well, if the cause of the blood clot is thought to be something that is reversible or something that just happened once. For example, let's say you had major surgery. Then when you were healing from the surgery, you got the blood clot. Well, the surgery is over and done with. That's not likely to be an ongoing instigating factor in forming more blood clots in the future. So there you would just do the minimum therapy 3 months. But if the blood clot, let's do the opposite extreme, is due to some sort of a genetic predisposition to forming clots, there's certain mutations that can do it, something that is likely to be a problem long term, you might even have to take the blood thinner for the rest of your life. So is that really bad? Is that like the end of the world? You get stuck on this blood thinner? Well, no. I mean, lots of people have to take blood thinners like this for a variety of different reasons, and it's usually pretty well tolerated, but it does increase risk of bleeding, with the biggest concern being a potentially life-threatening hemorrhage like a gastrointestinal bleeding. Now, that being said, bleeding is something we can treat in the hospital with blood transfusions if needed, procedures to stop the bleeding. But if you got a big blood clot, migrates to the lungs, causes cardiac arrest, and you're not in a hospital or healthcare setting, that can be immediately fatal. So if you have a big blood clot, DVT, PE, definitely the benefits of anticoagulation outweigh the risks for most people. The only exception is if somebody's just very prone to bleeding, or let's say they have a brain bleed, then you can't do it. But there's something else you can do, and that is a IVC filter. So that is where an interventional radiologist can place a filter in the inferior vena cava, or the large vein that goes into the heart. And the thought is that this can help prevent a blood clot from migrating into the heart and then getting into the lungs. Okay, that's a quick intro into deep vein thrombosis. I hope you found this video to be helpful. Here's another video you can check out right here. And if you're interested in more healthcare, health science related content, go ahead and hit that subscribe button here. And I'll catch you guys next time.